Hello, fellow classmates and professor. My name is Patrick Bailey, and I will be talking to y'all today about DBT. DBT stands for Dialectical Behavior Therapy, and this therapy method is usually used to treat patients with borderline personality disorder, or BPD. People who practice DBT often deal with a variety of behavior issues which can cause their clients problems and the people around them problems. The main focus of a DBT treatment is to teaching the patient more adequate skills to regulate their emotional distress and to integrate these skills in their everyday life. The function of being a DBT specialist includes being a navigator to people who are first times, sometimes into therapy, emotional cheerleader when you're praising the good and validating the bad. A collaborator is setting a healthy relationship between the psychologist and patient or client. Teacher is you're teaching your client the adequate skills. Juggler is you're juggling some of their problems that fit into the session. And a validator. The day-to-day tasks of being a DBT specialist will be performed in group or individual sessions or phone or video call sessions, with minor tasks being treatment planning and documentation of therapeutic services. Education. A person would need to have a master's degree in psychology or counseling. With being a DBT practitioner, you need to go through a rigorous assessment providing 40 hours of DBT training and passing the examination and passing the work demonstration. And also have clinical work in DBT for at least 12 months with a DBT consulting team. Group sessions will be usually held in a classroom setting, and there will be individual sessions will be in office setting. Being a DBT practitioner will include you to be a video or a phone coach, which can be done in the safety of your home. Most DBT specialists will work at a private practice intensive outpatient center where they will hold most of their group or individual sessions. Employment of substance abuse and behavior disorders and mental health counselors is projected to grow 22% from 2021 to 2031, much faster for any other occupation. From the Department of Labor. In recent months, pay for a psychologist can be between $30,000 at the lowest and $78,000 being at the highest in the year of 2021. The average pay of a mental psychologist will be around $49,000 to be depending on the state you live in, and the other factors will be affecting your pay, just as working for the government. A psychologist that works for the government can get paid upwards $60,000, and if you decide to work at a hospital, somewhere private, local, or state, you could potentially get an upward of $50,000. Lastly, if you decide to work at an outpatient mental health or a substance abuse center or a residential mental health facility, you can get an upward of $47,000. My interviewer today is clinical director at Atlanta DBT Center, Mino Shaw. Mino Shaw is an alumni of Kentucky and Georgia State who specializes in DBT, RO-DBT, DBT-PE, MBT, and psychodrama. Her office can be located in Norcross, Georgia. And to explain the potential benefits and drawbacks is Ms. Mino herself.
Okay, so the benefits are fantastic because it's got a bigger bevy of evidence-based outcomes than any other treatment in the history of psych, and most of them put together. Even more so than CBT at this point because it's more goal-directed and more focused in target areas, unlike CBT, which is a lot more of a broader application, even though most of it is centered on GAD and MDD. But that's the beauty of the efficacy of DBT. That and the fact that it is so methodical and so organized that illnesses that have not responded to any other treatment, even including CBT, because of their more of a throw the spaghetti on the wall, see what sticks kind of method, that DBT really works because it builds from the ground up, making an assumption that there is no capability that you should leave unattended to. So that's what I like about DBT, is that its applicability is for almost anybody and everyone in one way or another because of its methodical application. And you can just build from where a person has their strengths and just keep that trajectory going until they reach their goals. Now, the drawbacks are just that many, if not more, because it is time intensive, it's labor intensive, and the biggest problem with it is that if you get a practitioner that practices, or rather does, quote unquote, does DBT, and is not a true full practitioner of DBT, you get something called intermittent reinforcement of unwanted behaviors, because if they intermittently reinforce the very behaviors that they're trying to extinguish, they will actually make them stronger. And we see this in case after case after case in people who are not fully intensively trained nor practicing fully protocol DBT. And the biggest, I think the best example that we have across the board is when a patient is suicidal and they engage in a parasuicidal behavior. So say they cut, or they burn, or they binge, or they purge, or they drink, or they drug, or what have you. In typical treatment settings, a patient's going to call their therapist all dysregulated, discombobulated, and go, oh my God, I just cut myself. And the therapist is going to be like, oh my God, what are we going to do? I got to send you to the ER, I got to send you to treatment. And the therapist actually tends to the patient. So now the patient is reinforced in the thinking that I don't get attention when I'm doing quote, but I do get attention when I am completely dysregulated. So the brain gets a signal, let me be more dysregulated, because that's what the feeling.
And that is it for today's video. Hope y'all learned something. See ya.